Good evening, everyone. Welcome to our rationalization for Nloa 2 Prelim examination. This is Joseph Bahian Abang, and I'm actually in charge of discussing nursing practice for care of clients with physiologic and psychosocial alterations, Part B, care of adult clients in acute biologic crisis. Let's begin. Question number one. The emergency department nurse is caring for a patient who has been brought in by ambulance after sustaining a fall at home. What physical assessment finding is suggestive of a basilar skull fracture? A. Epistaxis. B. Periorbital edema. C. Bruising over the mastoid. Or D. Unilateral facial numbness. Of course, when we talk about basilar skull fracture, there has to be presence of battle sign. So that battle sign is actually an indicator that there is a basilar skull fracture, and that has to be seen in the mastoid process. So there is presence of bruising or ecchymosis in the mastoid area. When we talk about numbness, when we talk about edema and epistaxis, that is not directly associated with the basilar skull fracture. So number one, the best answer is letter C, bruising over the mastoid. Number two, a patient is brought to the trauma center by ambulance after sustaining a high cervical spinal cord injury 1 hour ago. Endotracheal intubation has been deemed necessary, and the nurse is preparing to assist. What nursing diagnosis should the nurse associate with this procedure? A. Risk for impaired skin integrity. B. Risk for injury. C. Risk for autonomic dysreflexia. Or D. Risk for suffocation. Of course, when we talk about if there is a need for us to have endotracheal intubation, there has to be an extreme care that is to be taken to avoid flexing or extending the patient's neck, which can result in extension of a cervical injury. So, intubation does not directly cause autonomic dysreflexia, and the threat to skin integrity is not a primary concern this time. And of course, the intubation itself does not carry the potential to cause suffocation because we are actually establishing an airway that is actually through a tube. But what is very important here is we talk about preventing further injury. Number two, the answer is letter B, because we know that we need to make sure that there is an extreme care that we need to include that will avoid flexing or extending the patient's neck, which could further increase the risk for injury. Answer for number two, bravo. Number three, a nurse is caring for a critically ill patient with autonomic dysreflexia. What clinical manifestations would the nurse expect in this patient? A. Respiratory distress and projectile vomiting. B. Bradycardia and hypertension. C. Tachycardia and agitation. Or D. Third spacing and hyperthermia. Of course, when there are two options that is opposing, one of which is actually correct, eliminate letter A, respiratory distress, and eliminate letter D, third spacing. So we're left with uh, bradycardia and hypertension, and tachycardia and agitation. Of course, we know if there is presence of autonomic dysreflexia, it is actually characterized by a pounding headache. There is presence of profuse sweating, and at the same time, there will be pillow erection, or that is on or having goosebumps, and that's also associated with bradycardia and hypertension. So if it occurs in cord lesions about the thoracic 6 after spinal cord shock has resolved, and it does not result in presence of vomiting, it will not result into tachycardia or even third spacing. Number three, the best answer is letter B, bradycardia and hypertension. Number four. So for number four, the question here is, which of the following the nurse is caring for a patient with increased intracranial pressure caused by a traumatic brain injury, which the following clinical manifestations would suggest that the patient may be experiencing increased brain compression causing brain stem damage? A. Hyperthermia. B. Tachycardia. C. Hypertension. Or D. Bradypnea. Signs of increasing intracranial pressure includes presence of slowing of the heart rate. There is presence of bradycardia, and there is an increasing systolic BP, and the patient will also have widening pulse pressure. So as the brain compression increases, there will be presence of increased in respirations. BP may decrease and the pulse slows further. A rapid rise in body temperature is regarded as unfavorable. Hyperthermia increases the metabolic demands of the brain and may indicate brainstem damage. So the best answer for number 4 is letter A, hyperthermia. That is hyperthermia. Number 5. A patient is brought to the emergency department by her family after falling off the roof. A family member tells a nurse that when the patient fell, she was knocked out but came to seem okay. Now she is complaining of a severe headache and not feeling well. The care team suspects an epidural hematoma, prompting the nurse to prepare for which priority intervention: A, insertion of an intracranial monitoring device; B, treatment with antihypertensives; C, emergency craniotomy; or D, administration of anticoagulant therapy. Of course, if there is presence of an epidural hematoma, that is considered to be an extreme emergency. And of course, that should be telling us that there is a marked neurologic deficit, or patient might also be manifesting respiratory arrest, and that can occur within minutes. So, a part of the treatments that is required is actually making an opening through the skull to decrease the intracranial pressure emergently. And there's also a need for us to do that because that will also help in removing the clot and also control the bleeding. So the best answer for number 5 is letter C, emergent craniotomy. And your anticoagulant management should not be ordered for a patient who has a cranial bleed because that will actually further the bleeding. And at the same time, insertion of an intracranial monitoring device may be done during the craniotomy process, and it's not actually a priority intervention. Number 5 is letter C. 6. The staff educator is precepting a nurse new to the critical care unit when a patient with a thoracic 2 spinal cord injury is admitted. The patient is soon exhibiting manifestations of neurogenic shock. In addition to monitoring the patient closely, what would be the nurse's most appropriate action? A. Prepare to transfuse packed red blood cells. B. Prepare for interventions to increase the patient's BP. C. Place the patient in Trendelenburg position. Or D. Prepare an ice bath to lower core body temperature. In this case, the best answer is letter B, because this is already a manifestation of neurogenic shock, and that includes a decrease in BP. Uh, there's also uh, problems of the heart rate, and cardiac markers would be expected to rise in cardiogenic shock. So the interventions that is focused on transfusion, repositioning, and ice baths are not indicated interventions. The best answer is letter B, which is basically on preparing the patient, interventions to increase the BP of the patient. 6, it's Bravo. 7, an emergency department nurse has received a call from EMS that they are transporting a 17-year-old man who has just sustained a spinal cord injury, or SCI. The nurse recognizes that the most common cause of this type of injury is what? A. Sports-related injuries. B. Acts of violence. D. Injuries due to fall. Or D. Motor vehicle accidents. Of course, when we talk about spinal cord injuries, the most common cause of that is that amounts to 46%. That is already classified in motor vehicle crashes. And if that is talking about falls, that is 22%. And then for violence, that's 16%. And if that is on sports related events, that is only 12%. So the best answer for number 7 is letter D, motor vehicle accidents. 8. A patient with spinal cord injury has a nursing diagnosis of altered mobility, and the nurse recognizes the increased risk of deep vein thrombosis. Which of the following would be included as the appropriate nursing intervention to prevent DVT from occurring? A. Placing the patient on a fluid restriction is ordered. B. Applying thigh high elastic stockings. Or C. Administering an antifibrinolytic agent. Or D. Assisting the patient with passive range of motion exercises. Of course, when we talk about DVT, it's important to promote venous return to the heart, and that is actually one way of preventing venous stasis in the patient with altered mobility. And the best way for us to do here is applying elastic bandage or elastic stockings will aid in the prevention of DVT. And of course, the patient should not be on a fluid restriction because a dehydrated patient will actually increase risk of DVT or clotting throughout the body. And your Uh, Antifibrinolytic agent can cause the blood to clot, which is absolutely contraindicated in this situation. And of course, when you talk about PRRM, not an effective protection against development of DBT. So the best answer here is Bravo. 9. Paramedics have brought an intubated patient to the RD following a head injury due to acceleration distillation motor vehicle accident. Increase in ICP is suspected. Appropriate nursing interventions would include which of the following: A. Keep the head of the bed flat at all times. B. Teach a patient to perform the Valsalva maneuver. C. Administer benzodiazepines on PRN basis. Or D. Perform endotracheal suctioning every hour. Of course, if the patient with brain injury is considered to be very agitated, it's very significant for us to administer our benzodiazepines because that is used to sedate the patient, and of course that doesn't have any effect at all with cerebral blood flow or in the increase in ICP or in the intracranial pressure. And the head of bed should be elevated for 30 to 45 degrees, and suctioning should be done on a limited basis due to increasing the pressure in the cranium. And Valsalva maneuver is also avoided because this also increases the intracranial pressure. So the best answer here is administer benzodiazepines on a PRN basis. Number 10. A patient has sustained a non-depressed skull fracture is admitted to the acute medical unit. Nursing care should include which of the following: A. Preparation for emergency craniotomy. B. Watchful waiting and close monitoring. C. Administration of inotropic drugs. Or D. Fluid resuscitation. If the patient has a non-depressed skull fractures, they do not generally require surgical treatment. However, if there is presence, there's a need for us to have close observation of the patient, and that is considered to be essential. So number 10 is B, and a craniotomy would not likely be needed in the fracture if the fracture is actually non-depressed, and if even if treatment is warranted, it is unlikely to include inotropes and fluid resuscitation. 10, letter B. 11. A patient who suffered a spinal cord injury is experiencing an exaggerated autonomic response. What aspect of the patient's current health status is most likely to have precipitated this event? A. The patient received a blood transfusion. B. The patient's analgesia regimen was recent change. C. The patient was not repositioned during the night shift. Or letter D. The patient's urinary catheter became occluded. Of course, when there is presence of spinal cord injury, that could a distended bladder can actually exacerbate autonomic response. So the best answer for number 11 is letter D. If there is an occlusion of the urinary catheter, that can cause distended bladder, and it's actually one of the most common cause of autonomic dysreflexia. If there is infrequent positioning, that is less likely, although it can cause problems of pressure ulcer, or tactile simulation can cause it. And if there's a need for us to talk about changes in medications or blood transfusions are considered to be unlikely causes. But the most common cause of this one is your distended bladder. And the reason for that one is kinked or occluded urinary catheter. 11, delta. 12. A patient is admitted to the neurologic ICU with a spinal cord injury. In writing the patient's care plan, the nurse specifies that contractures can best be prevented by what action? A. Repositioning the patient every 2 hours. B. Initiating range of motion exercises as soon as the patient initiates. C. Initiating exercises as soon as possible after the injury. Or D. Performing ROM exercises once a day. So number 12, the best answer is letter C. Initiating exercises as soon as possible after the injury, because it would be inappropriate to wait for the patient to first initiate exercises. And of course, that could possibly include the toes, the metatarsals, the ankles, and the knees. Should not put through a full ROM at least 4 hours, and ideally it should be 5 hours. And of course, it's 5 times daily. Repositioning alone will not prevent the contractures. Number 12, the answer is letter C. Let's proceed now to the second part, which is about care of adults in response to emergency situations. Question 13. Which patient should the nurse prioritize as needing emergent treatment, assuming no other injuries are present except the ones outlined below? A. A patient with a blunt chest trauma with some difficulty breathing. B, a patient with sore neck was immobilized in the field on the backboard with a cervical collar. Letter C, a patient with a possible fractured tibia with adequate pedal pulses, or D, a patient with an acute onset of confusion. So in this case, we are talking about except the ones outlined below, except we're looking for a wrong answer. So the patient with blunt chest trauma possibly has a compromised airway. Establishment and maintenance of the patient airway and adequate ventilation is prioritized over other uh, health problems, including skeletal injuries and changes in cognition. So what we're looking here is focused on prioritization. So we need to prioritize letter A because there is a problem with breathing. Then after that is we talk about letter B, and third is D, fourth is letter C. Well, the best answer for number 13 is letter A because there is airway involvement. 14. The nurse observes that the family members of a patient who was injured in an accident are blaming each other for the circumstances leading up to the accident. The nurse appropriately lets the family members express their feelings of responsibility while explaining that there was probably little they could do to prevent the injury. In what stage of crisis is this family? A. Anxiety and denial. B. Remorse and guilt. C. Anger, or D. Grief. The answer here is letter B. That's remorse and guilt. Because we know that if there's remorse and guilt, that's considered to be part of the natural processes of stages of a crisis and should be facilitated for the family members to process the crisis. And the family's sense of blame and responsibility are more suggestive of guilt than anger, grief, or anxiety. 14, the best answer is remorse and guilt. 15. A patient is brought to the ED by ambulance with a gunshot wound to the abdomen. The nurse knows that the most common hollow organ injured in this type of injury is what? A. Liver, B. Small bowel, D. Stomach, or C. Stomach, or D. Large bowel. Of course, if there is presence of penetrating abdominal wounds, have a high incidence of injury to hollow organs, especially the small bowel. And of course, the liver is also injured frequently, but it is a solid organ. So hollow organ is being asked. So we're talking about small bowel, either the small bowel, the stomach, or the large bowel. But that is on the abdomen. That should be letter B, small bowel. 16. A patient has been brought to the ED with multiple trauma after a motor vehicle accident. After immediate threats to life have been addressed, the nurse and trauma team should take what action? A. Perform a rapid physical assessment. B. Initiate health education. C. Perform diagnostic imaging. Or D. Establish the circumstances of the accident. The best answer here is letter A. Perform a rapid physical assessment. Of course, uh, if you have actually corrected the threats, then the next thing that you need to do is to perform rapid physical examination in order to identify injuries and at the same time priorities of treatment. So when you talk about health education, when you talk about diagnostic imaging, and at the same time team's responsibility, that's not the priority this time. Your priority is basically on having a baseline data, and that is performing a rapid physical assessment. 16, answer alpha. 17, the nursing educator is reviewing the signs and symptoms of heat stroke with a group of nurses who provide care in a desert region. The educator should desert region. The educator should describe what sign or symptom. A. Hypertension with a wide pulse pressure. B. Anhydrosis. C. Copious diuresis. Or D. Kind stroke respiration. Of course, when you say that is signs of heat stroke, so we are talking about presence of confusion, presence of bizarre behavior, elevated body temperature. There is hot dry skin, tachypnea, hypotension, and tachycardia. So the health problem is actually not associated with presence of anhydrosis or kind stroke respiration. So the best answer here is what? Is it hypertension with a pulse pressure? Uh, is it uh, is it copious diuresis? Letter C is wrong, And letter D is actually wrong as well. So the best answer here is letter A, hypertension with a wide pulse pressure. 17, alpha. 18, a patient is brought to the ED by ambulance after swallowing high acidic toilet bowl cleaner 2 hours earlier. The patient is alert and oriented. What is the care team's most appropriate treatment? Administering syrup of ipecac, performing a gastric lavage, giving milk to drink, or referring to psychiatry. So the best answer here is letter. No need for syrup of ipecac here because that will actually simulate vomiting. So you may give milk or water to dilute to dilute or dilution, and gastric lavage must be performed within 1 hour of ingestion. So the 2 hours already, so that's not any more effective. And a psychiatric consult may be considered once a patient is physically stable and is deemed appropriate by the physician. And as what I mentioned, syrup of baby cock is not anymore used in the clinical settings now. 18 is give milk to drink. 19. A patient is admitted to the ED with suspected alcohol intoxication. The ED nurse is aware of the need to assess for conditions that can mimic alcohol intoxication. In light of this need, the nurse should perform what action? A. Check the patient's blood glucose level. B. Assess for a documented history of major depression. C. Determine whether the patient has ingested a corrosive substance. Or D. Arrange for assessment of serum potassium levels. The best answer for number 19 is letter A. Because we know a patient with hypoglycemia can actually mimic alcohol intoxication and should be assessed in a patient suspected of alcohol intoxication. So, potassium imbalances, the presence of depression, and poison ingestion are not noted to mimic the characteristics of signs and symptoms of alcohol intoxication. 19. Blood glucose level, alpha. 20. The paramedics bring a patient who has suffered a sexual assault to the emergency department. What is important for the sexual assault nurse examiner to do when assessing a sexual assault victim? Respect the patient's privacy during assessment, shave all pubic hair for laboratory analysis, place items for evidence in plastic bags, or bathe the patient before the examination. So, of course, your priority here is about privacy and sensitivity. And of course, a patient will be experiencing a stress response to assault. And of course, pubic hair is combed or trimmed for sampling but not shaved. Paper bags are used for evidence collection because plastic bags retain moisture, which promotes molds and mildew that can destroy evidence. Within the patient before the examination would destroy or remove the key evidence. So answer here is letter A. 21. A patient with a history of depression is brought to the emergency department by her parents, which are following nursing actions is most appropriate. Noting that symptoms of physical illness are not relevant to the current diagnosis. Be asking the parent if she has even ever thought about taking her own life. C. Conducting interviews in a brief and direct manner. D. Arranging for the patient to spend time alone to consider her feelings. So the best answer here is letter B. Asking the patient if she has ever thought about taking her own life. So establishing if the patient has suicidal thoughts or intents helps identify the level of depression and intervention. Physical symptoms are relevant and should be explored. Allow the patient to express feelings and conduct the interview at a tolerable pace for the patient. Never leave the patient alone because suicide is usually committed on a solitude. So answer for number 21 is letter B. 22. A triage nurse is talking to a patient. When the patient begins choking on his lunch, the patient is coughing forcefully. What should the nurse do? Stand him up and perform the abdominal thrust maneuver from behind. Lay him down, straddle him and perform the abdominal thrust maneuver. Or C. Leave him to get assistance. Or D. Stay with him and encourage him but not intervene at this time. So, of course, if the patient is coughing, you should be able to dislodge the object or cause the complete obstruction. So, if complete obstruction occurs, the nurse should perform the abdominal maneuver with the patient standing. And if the patient is unconscious, the nurse should lay the patient down, and a nurse should never leave a choking patient alone? Answer here is letter D. Stay with him and encourage him, but not intervene at this time because he can still forcefully cough. 22. Answer Delta. 23. You are a floor nurse caring for a patient with alcohol withdrawal syndrome. What would be an appropriate nursing action to minimize the potential for hallucinations? A. Encourage the patient in a process of health education. B. Administer opioid analgesic as ordered. C. Place the patient in a private, well-lit room or provide television or radio as therapeutic distraction. The answer here is letter C. Place a patient in a private, well-lit room. The patient should be placed in that room that is actually non-stressful environment. Presence of TV and radio stimulation should be avoided, and analgesics are not normally necessary and would potentially contribute to hallucinations. And of course, health education would be inappropriate while the patient is experiencing acute withdrawal. 23. Charlie. 24. An obtunded patient is admitted to the emergency department after ingesting bleach. The nurse should prepare to assist with what intervention? A. Prompt administration of an antidote. B. Gastric lavage. C. Administering of activated charcoal. Or D. Helping the patient drink large amount of fluids or water. So, of course, if the patient ingested a corrosive poison such as bleach, so our goal here is to give water or milk to drink for dilution. And as what I mentioned earlier, gastric lavage is used if that is an hour or less. And of course, that is also not used to treat ingestion of corrosives and activated charcoal is ineffective in clinical settings. So, answer for number 24 is letter D. 25. A 6-year-old is admitted to the ED after being rescued from a pond after falling through the ice while ice skating. What action would the nurse perform while rewarming the patient? A. Assessing the patient's oral temperature. B. Ensuring continuous ECG monitoring. C. Massaging the patient's skin surfaces to promote circulation. Or D. Administering bronchodilators by nebulizer. So in this case, a patient who is actually hypothermic requires continuous ECG monitoring and assessment of core temperatures with an esophageal probe, bladder, or rectal thermometer. Massage is not performed, and bronchodilators would be insufficient to meet the patient's respiratory needs. 25. The best answer is Bravo. Let's proceed now to the third part, which is on care of adult clients in response to disaster and mass casualty. 26. The nurse manager in the emergency department receives information that a local chemical plant has had a chemical leak. This disaster is assigned a status of level 2. What does this classification indicate? Is it first responders can manage the situation? B. Regional efforts and aid from surrounding communities can manage the situation? C. Statewide or federal assistance is required? Or D. The area must be evacuated immediately? Of course, when we talk about level 2, that indicates regional efforts from the surrounding communities that will be able to manage the situation. If that is, local efforts are likely to be overwhelmed, while state and federal assistance are not necessary because that will be focused on level 3 or 4. The disaster level does not indicate necessity of evacuation this time. Answer is letter B. Regional efforts and aid from surrounding communities can manage the situation. 27. A workplace explosion has left a 40-year-old man burn over 65% of his body. His burns are second and third degree burns, but he is conscious. How would this person be triaged? A. Green. B. Yellow. C. Red. Or D. Black. So the purpose of triaging is basically to do the greatest good for the greatest number of people. And the patient would be triaged as black due to unlikelihood of survival because you talk about 65% of the body. Persons triaged as green, yellow, or red have a higher chance of recovery over severely burned. Second and third degree burn pa. 27. D. 28. A patient has been witness to a disaster involving a large number of injuries. The patient appears upset but states that he feels capable of dealing with his emotions. What is the nurse's most appropriate intervention? Educate the patient about the potential harm in denying his emotion. B. Refer the patient to social work or spiritual care. C. Encourage the patient to take a leave of absence from his job to facilitate emotional healing. Or D. Encourage the patient to return to normal social roles when appropriate. So the best answer here is letter D. Encourage the patient to return to normal social roles when appropriate, because that there's a need for us to encourage this patient if he is already confident and genuine about his ability to cope. And the nurse should also use active listening in order for the patient's for to the patient's concerns and emotions to enable the patient to process the situation. And the patient is not necessarily being unrealistic or dishonest. As a result, social work or spiritual care may not be needed, and time away from work may not be required. 29. A nurse is caring for a patient exposed to a terrorist attack involving chemicals. The nurse has been advised that personal protective equipment must be worn in order to give the highest level of respiratory protection with a lesser level of skin and eye protection. What level protection is this considered? A level A, B level B, C level C, or letter D level D. So when we talk about when you talk about letter C, level C, it incorporates the use of air purified respirator. There is also presence of chemical resistant coverall with splash hood, and for level D is the same as a work uniform. Then the best answer for this one is letter B, level B, because when I say level A, it provides the highest level of respiratory mucous membrane, skin, and eye protection. So in this case, 29, the best answer is letter B. 30. A patient has been exposed to anthrax is being treated in a local hospital. The nurse should prioritize what health assessment? A. Integumentary assessment. B. Assessment of for signs of hemorrhage. C. Neurologic assessment. Or D. Assessment of respiratory status. Of course, we know that anthrax affects the airway, includes respiratory distress, and there will be presence of stridor, hypoxia, diaphoresis, hypotension. So therefore, the priority is letter D. After that is we talk about the neurologic assessment. Next is the sense of hemorrhage, and then integumentary system is the fourth. 30, letter D. 31. When assessing patients who are victims of chemical agent attack, the nurse is aware that assessment findings vary based on the type of chemical agent. The chemical sulfur mustard is an example of what type of chemical warfare agent? A. Nerve agent. B. Blood. C. Pulmonary. Or D. Vesicant. The answer here is vesicant, because sulfur mustard is a chemical that causes blistering and results in burning. There's presence of conjunctivitis. It can also cause bronchitis and pneumonia. So 31 answer, it is a vesicant. 32. A major earthquake has occurred within the vicinity of the local hospital. The nursing supervisor working the night shift at the hospital receives information that the hospital disaster plan will be activated. The supervisor will need to work with what organization responsible for coordinating intra-agency relief assistance? A. Office of Emergency Management. B. Incident Command System. C. Centers for Disease Control and Prevention. D. Philippine Red Cross. Answer here is letter A. Office of Emergency Management, because they helps in coordinating disaster relief efforts at local levels. And we know that the Incident Command System, it's a management tool to organize personnel, facilities, and equipment. And CDC is an agency for disaster prevention and control of support state and local health department. And of course, we know that if that is the Red Cross, that is going to help in providing additional support. 33. While developing an emergency operations plan, the committee is discussing the components of the EOP during the post-incident response of an emergency operations plan. What activity will take place? A. Deciding when the facility will go from disaster response to daily activities. B. Conducting practice drills for the community and facility. C. Conducting critic and debriefing for all involved in the incident. Or D. Replacing the resources in the facility. The answer is letter C, conducting critic and debriefing for all involved in the incident. So that is considered to be a post-incident response that includes critiquing and debriefing all parties that involved immediately and at latter dates. It does not include decision to go from disaster response to daily activities, and it does not include practice drills, and does not include as well replacement of resources in the facility. The answer here is letter C. 34. The announcement is made that the facility may return to normal functioning after a local disaster. In emergency operations plan, what is this referred to as? A, demobilization response; B, post-incident response; C, crisis diffusion; or D, reversion. The answer here is letter A, demobilization response. And that occurs when it's deemed necessary that the facility may return to normal daily functioning. This is known to as the post-incident response, and that is also crisis diffusion or reversion. Answer alpha 35. A group of disaster survivors is working with a critical incident stress management team. Members of this team should be guided by what goal? Determining whether the incident was managed effectively, educating survivors on potential coping strategies for future disasters. C, providing individuals with education about recognizing stress reactions. Or D, determining if individuals responded appropriately during the incident. The answer here is letter C, providing individuals with education about recognizing stress reactions. 36. Level C, personal protective equipment, has been deemed necessary in the response to an unknown substance. The nurse is aware that the equipment will include what? Is it self-contained, bathing apparatus, vapor-tight, chemical-resistant suit, uniform only, or D, an air-purified respirator? So the best answer here is letter D, an air-purified respirator. Uh, when we talk about level A, that is providing highest level of respiratory mucous membranes. Level B, that is for PPE, that is for respiratory protection. Then for level D, that is same as a worked uniform. But in this case, we need to talk about air purified respirator. That's letter D. 37. An emergency department staff members have been trained to follow steps that will decrease the risk of secondary exposure to a chemical. When conducting decontamination, staff members should remove the patient's clothing and then perform what action? Rinse the patient with water, wash the patient with dilute bleach solution, or de-wash the patient chlorhexidine, or de-rinse the patient with hydrogen peroxide. Of course, the most important thing that we need to do is just plain water, not bleach, not chlorhexidine, and not hydrogen peroxide. Answer for 37, alpha. And that is it. Thank you so much, everyone, for listening.